Standing at the foot of the plinth, grasp the ankles and gently apply traction to the legs. Starting with your model's left leg, gently grasp from the ankle and up to the knee, and then continue up to the thigh. Grasp the ankle with your left hand, place your right hand under the knee and flex the knee vertically. And when you bring the leg back down again, make sure you place your hand under the knee to prevent the knee from locking. Maintaining your grasp on the ankle, place your hand under the knee again and lift and pull the knee outwards or towards you, while slowly applying rotation to the hip. And when you bring the leg back down again, make sure that you place your hand under the knee to prevent the knee from locking. Still maintaining your grasp on the ankle, place your hand back under the knee and gently lift and push the knee inward or away from you, while slowly applying rotation to the hip. When you bring the leg back down again, make sure you place your hand under the knee to prevent the knee from locking. And moving over to the right leg, gently grasp from the ankle up to the knee and then continue on up to the thigh. Grasp the ankle with your right hand, place your left hand under the knee and flex the knee vertically. When you bring the leg back down again, make sure you place your hand under the knee to prevent the knee from locking. Maintaining your grasp on the ankle, place your hand under the knee and lift and pull the knee outwards towards you while slowly applying rotation to the hip. Bring the leg back down again, making sure your hand is under the knee to prevent the knee from locking. Maintaining the same grasp on the ankle, place your hand back under the knee, lifting the knee, push the knee inward or away from you while applying gentle rotation to the hip. When you bring the leg back down again, place your hand under the knee to prevent it from locking and move up to the right arm. Grasp from the wrist to the elbow and continue on up to the shoulder. Grasp the right wrist with both hands and your direction should be 45 degrees to the body and apply traction while shaking out the arm. And then return the hand to lie on the abdomen or most comfortable position for your model. Moving on to the left arm, grasp from the wrist to the elbow and continue on up to the shoulders. Grasp the left wrist with both hands. Your direction should be 45 degrees and apply traction while shaking out the arm. Return the hand to lie on the abdomen or most comfortable position for the model. And moving on to the head. Sit and balance yourself on your stool, placing both feet firmly on the ground. Gently stretch the neck by placing your dominant hand under the neck and applying the stretch. Support your hand with your other hand. You may or may not feel a dural pulse. This is dependent on your model and also the environment that influences your model. Relax and breathe evenly, deeply, breathing in through your nose and out through your mouth, keeping the tip of your tongue to the roof of your mouth, just behind your teeth. Moving on to the finger lift, we lift the head by placing your fingertips on the occiput and holding the head in this position. You should feel the bone of the skull while holding this part of the sequence. Keep breathing gently and in a relaxed manner. Pull the neck to the left. Push the right shoulder down with your right hand, applying a gentle stretch to the neck and shoulder. Keep your hand under the head while you apply this technique and stimulate GB20. Make sure not to apply too much pressure or force. Remember appropriate pressure, appropriate duration, appropriate rhythm and gentleness. Watch your model's facial expression for any signs of pain. Using 2 fingers, knead down the sternocleidomastoid muscle gently, slowly and only in one direction, down to stimulate GB21. Take care not to press too deeply on this point. This point is forbidden during pregnancy. It has a function of relaxing the tendons, ligaments and sinews. Next, simulate Sanjiao 15. Unbinds the chest. Next, pull the head to the right. Push the left shoulder down with your left hand, applying a gentle stretch to the neck and shoulder. Keep your hand under the head while you apply this technique. Stimulate GB20, making sure not to apply too much pressure. GB20 subdues liver yang. It also brightens the eyes when the eyes lack vitality. It benefits the ears, especially for tinnitus. It clears heat, especially headaches that are brought on by heated situations. Clears the brain, bringing clarity of thought. It's a very good point for headaches and clear thinking. Next, using 2 fingers, knead down the sternocleidomastoid muscle. Gently, slowly, only in one direction, down to stimulate GB21, which is forbidden during pregnancy because it promotes delivery if baby is late. And it promotes lactation. Next, stimulate Sanjiao 15. Sanjiao 15 unbinds the chest and regulates qi. Next, we're going to move on to the facial rejuvenation sequence, where we're going to stimulate Yin Tan. An excellent point for promoting sleep, calming the mind, stopping convulsions. Next, we're going to stimulate bladder 2. It soothes the liver, stops pain, it clears heat and clears the head. Next, we move to the middle of the eyebrow to stimulate Yu Yao. Clears heat, brightens the eyes and relaxes the sinews. Next, we're going to move to the lateral end of the eyebrows to stimulate Sanjiao 23, which brightens the eyes, stops pain. Next, we stimulate Tai Yang on the temples, using your index finger bilaterally and gentle forward circular stimulation. Clears fire, relieves headaches. Next, we're going to move up to stimulate stomach 8. Stomach 8 relieves pain, brightens the eyes, clears heat, relieves dizziness. Next we're going to stimulate GB15. GB15 is found half its sun within the hairline, midway between Do24 and stomach 8. It regulates the mind and balances emotions. Next we're going to stimulate Do24. Do24 is found on the midline, half its sun within the anterior hairline. Do24 calms the mind. Next we're going to stimulate Yi-Zong, one sun directly above Yin-Tan. Calms the mind, relieves dizziness. It benefits the eyes and regulates emotions. Next we're going to stimulate GB14, one sun directly above the midpoint of the eyebrow, and subdues rising qi. Next we're going to move under the eye to stomach 2. Very gently stimulate stomach 2. Brightens the eyes. Next we're going to stimulate large intestine 20. Large intestine 20 is an excellent point for promoting our sense of smell, for sinusitis, for catarrh, allergic rhinitis. And then we move on to stimulate Bi-Tong. Benefits the nose, loosens stagnation, benefits our sense of smell. And next we're going to move on to the left hand. Where we're going to stimulate large intestine 4. Large intestine 4 is forbidden during pregnancy. Next we want to spread the metacarpals and rotate the hand to knead the palm, locking both our little fingers at the junctions of our model's thumb and little finger. You can knead the palm with your knuckles, or you may also use your thumb pads. Be sure to watch your posture. Next we move on to the fingers, slowly and gently, maintaining as much skin contact as possible. Press the top and bottom of each finger, from knuckle to fingertip, in about 4 presses. Press the sides of each finger, from knuckle to fingertip, and then rotate the finger and flick the finger, which breaks any stagnation in the finger joints, and move on to stimulate the remaining 4 fingers. Next we're going to move on to the anterior aspect of the left arm. Holding the wrist, lift the arm, thumb knead up the anterior arm without scraping, only moving the flesh beneath the skin, slowly and gently. We continue to knead up with the thumb up the anterior aspect of the arm, up the transverse cubital crease. Next we move on to the posterior aspect of the left arm. Holding the wrist, proceed to knead with the pad of your thumb up the posterior arm without scraping,
At the elbow, we're going to gently grasp large intestine 11 and heart 3 between your thumb and your index finger or your middle finger and rotate the elbow clockwise and then anti-clockwise or vice versa.
Large intestine 11 clears heat. Heart 3 calms the mind and clears heat. Next, place the arm on the plinth, grasp the wrist and knead up from the elbow to the shoulder. While still holding the wrist, step up and abduct the arm to locate large intestine 15 and Sanjiao 14. Bring the arm to a 45-degree angle to the body and apply traction while shaking out the arm, and maintain stimulating appropriate pressure to these points, which remove obstructions from the channels. In this area, they benefit the sinews and the shoulder joint. Relax your traction and place the left arm on the plinth or on the abdomen and move over to the right arm. Where you're going to stimulate large intestine 4 on the right arm. Remember, this point is contraindicated in pregnancy also. Large intestine 4, in addition to the other functions I listed earlier, stops pain, it removes obstructions from the channel, it tonifies qi, harmonizes ascending and descending. Next, we're going to spread the metacarpals, rotate the hand and knead the palm, locking both our little fingers at the junctions of our model's thumb and little finger. Knead the palm with your knuckles, or you may also use your thumb pads. Next, we move on to the fingers, slowly and gently, maintaining as much skin contact as possible. Press the top and bottom of each finger, from knuckle to fingertip, in about 4 presses. Press the sides of each finger, from knuckle to fingertip, and then rotate the finger and flick the finger, which breaks any stagnation in the finger joints, and move on to stimulate the remaining 4 fingers. Next, we're going to move on to the anterior aspect of the right arm. Holding the wrist, thumb knead up the anterior arm without scraping, only moving the flesh beneath the skin. Turn the arm and we're going to hold the wrist, proceed to knead up the posterior aspect of the arm. Continue to knead up with the thumb up towards the lateral end of the cubital crease.
At the elbow, we're going to gently grasp large intestine 11 and heart 3 between your thumb and your index finger or your middle finger and rotate the elbow clockwise and then anti-clockwise or vice versa.
Large intestine 11 again clears heat. Heart 3 calms the mind and clears heat. Place the arm back on the plinth, grasp the wrist and knead up from the elbow to the shoulder. While still holding the wrist, step up and abduct the arm to locate large intestine 15 and Sanjiao 14. Bring the arm to 45-degree angle to the body and apply traction while shaking out the arm and maintain stimulating appropriate pressure to these 2 points, which are excellent points for relieving heaviness, pain with numbness from the shoulders. Relax the traction and place the right arm on the plinth, and we can move on to the legs. Grasp the ankles, apply light traction to the legs. And then using your thumb pads bilaterally stimulate kidney 1. Kidney 1 tonifies yin, clears heat, subdues empty heat, calms the mind and restores consciousness as well as clears the brain. Next we're going to stimulate spleen 3, strengthens the spleen, strengthens the spine. Next we're going to stimulate spleen 4. Spleen 4 tonifies spleen and stomach, stops bleeding, dispels fullness, pacifies the stomach and regulates menstruation. Next we move on to the left leg and we stimulate liver 3. Liver 3 subdues liver yang and promotes the smooth flow of liver qi, as well as nourishes liver blood and yin and regulates menstruation. Next we move over to stimulate liver 3 on the right leg. Liver 3 calms the mind also and calms spasm. Next we're going to stimulate kidney 6 bilaterally. Kidney 6 calms the mind, it nourishes yin, benefits the eyes. It cools the blood, it benefits the throat and promotes the function of the uterus. Next week we move to the left leg and stimulate kidney 3 and bladder 60 in a pinch and rotate. Remember, bladder 60 is contraindicated to pregnancy. Kidney 3 benefits essence, tonifies the kidneys, strengthens the lower back and knees and regulates the uterus. Next we move on to the right leg where we're going to stimulate kidney 3 and bladder 60. Bladder 60 removes obstructions from the channel, relaxes the sinews, clears heat and invigorates blood as well as strengthening the back. Next we're going to stimulate spleen 6 bilaterally. Spleen 6 is forbidden during pregnancy, strengthens the spleen, promotes the function of the liver and the smooth flow of liver qi, tonifies the kidneys, nourishes blood and yin and benefits urination. It also regulates the uterus and moves stagnation, cools the blood. Next we're going to move on to spleen 9. Spleen 9 benefits the lower jiao, benefits urination. And we stimulate spleen 10. If you can't reach this point from the bottom of the plinth, step to the left leg of your model and stimulate both points, taking care to maintain good posture. Spleen 10 removes stasis of blood, regulates menstruation, cools the blood. Moving to the left side of your model, the left leg, stimulate GB34. Promotes the smooth flow of liver qi, relaxes the sinews and subdues rebellious qi. Next we're going to stimulate stomach 36. Stomach 36 benefits the spleen and stomach, tonifies qi and blood, dispels cold, strengthens the body. Next we're going to dredge the spleen and stomach meridians. We're going to go down the stomach meridian and up the spleen 3 times. Then we're going to lift the leg, bend the knee, sit on the plinth to prevent the leg from sliding, and dredge the gastrocnemius. Clasp both hands behind the gastrocnemius and pluck the length of the gastrocnemius. Vibrate the belly of the gastrocnemius. We place the leg onto the plinth and move over to the right leg of your model, where you're going to stimulate GB34. GB34 promotes the smooth flow of liver qi, subdues rebellious qi, relaxes the sinews. And next we're going to stimulate stomach 36, benefits the spleen and stomach, raises yang, regulates the intestines, brightens the eyes and strengthens the body. Next we're going to dredge the spleen and stomach meridians, down the stomach, up the spleen 3 times. Then we're going to lift the leg, bend the knee, sit on the plinth to prevent the leg from sliding, and dredge the gastrocnemius. Clasp both hands behind the gastrocnemius and pluck the length of the gastrocnemius. Vibrate the belly of the gastrocnemius. Replace the leg onto the plinth and we'll move on to the abdomen on the same side. Gently rub the abdomen with the full palm of your hand, just to warm it. Next, we're going to knead the abdomen with the heel of the palm of our hand in a clockwise direction along the large intestine or colon, up the ascending colon, across the transverse colon, and down the descending colon and sigmoid colon. Next we're going to vibrate the palm of our hands over Ren 8. Next we're going to locate and vibrate finger point over Ren 4. Ren 4 nourishes yin, strengthens yang, regulates the uterus, benefits original qi, tonifies the kidneys. Next we stimulate Ren 6, tonifies qi and yang, regulates qi, tonifies original qi. Next we're going to stimulate stomach 25, promotes the function of the intestines, clears heat, regulates qi and relieves retention of food. Next we're going to vibrate Ren 12, tonifies spleen and stomach, regulates stomach qi and improves digestion. Next we're going to stimulate stomach 21. Stomach 21 regulates the stomach, subdues rebellious qi, stops vomiting, and relieves pain. We're going to finish the abdominal sequence by vibrating over Ren 8 again. And then we move on to the back. We want to assist your model to turn onto his or her front to allow access to the back. Patient lies on the stomach. Next we're going to do circular kneading just to warm the back. Rock the body with wide amplitudes and slow rocking. Next, with the palm, we're going to knead down both sides of the bladder meridian. Next we're going to do holding and twisting, press and stretch opposite shoulder and pelvis. Next we're going to do gunfa rolling over the back muscles. We're moving up to the head of the plinth, where we spread the upper back, scapula, and check for chi stagnation or trigger points. Next we're going to knuckle knead the upper back. This is the upper part of the bladder line. We're going to continue to knuckle knead down the neck, out over GB21. Next we're going to knead with our thumbs bilaterally down along the bladder meridian, starting with bladder 11. Bladder 11 nourishes blood, strengthens the bones and soothes the sinews. Next, bladder 12. Stimulates the lung dispersing function and regulates yang and wei qi. Next is bladder 13. Stimulates the lung dispersing and descending function, regulates lung qi, tonifies lung qi, stops cough and clears heat. Next is bladder 14. Bladder 14 regulates the heart, calms the mind. Next is bladder 15. Bladder 15 calms the mind, clears heat, stimulates the brain, invigorates blood, nourishes the heart and nourishes heart yin. Next is bladder 16, regulates the heart and invigorates blood. Next is bladder 17, invigorates blood, nourishes blood, opens the chest. It also tonifies qi in blood and clears heat, calms the mind. Next is bladder 18, the back shoe point for the liver. Benefits liver and gallbladder. Removes stagnant qi, benefits the eyes. Next is bladder 19. Pacifies the stomach, relaxes the diaphragm. Next is bladder 20, the back shoe point for the spleen. Tonifies the spleen and stomach, nourishes blood. Next is bladder 21, back shoe point for the stomach, regulates and tonifies stomach qi, pacifies the stomach and relieves retention of food. Then we move to the side of the plinth. Next is bladder 22, back shoe point for the St. Jiao. Opens the water passages. Next is bladder 23, the back shoe point for the kidneys. Tonifies the kidneys and nourishes kidney essence, as well as strengthening the back, nourishes blood, benefits the bones and marrow. Brightens the eyes and benefits the ears. Next is bladder 24. Strengthens the lower back, removes obstructions from the channel, regulates qi and blood and tonifies kidney yang, dispersing cold. Next is bladder 25. Promotes the function of the large intestine. It's the large intestine's back shoe point, strengthens the lower back, removes obstructions from the channel, relieving fullness and swelling. Next is bladder 26, the origin gate back shoe point. Strengthens the lower back, removes obstructions from the channel. Bladder 27 is the small intestine back shoe point. Promotes the function of the small intestine. clears heat, benefits urination. Next is bladder 28, the urinary bladder back chute point. Regulates the bladder, clears heat, stops pain. Strengthens the loins. Next is bladder 29. Next is bladder 30. Next is bladder 31. Nourishes the kidneys, regulates the lower jaw, tonifies the lumbar region. Next, knead in general the lumbar region, from the pelvic region, then up the upper back. Next is striking or chopping. Next is cupping. Next is patting, hollow fist. Next is scrubbing, warming the Du-4, the fire at the gate of vitality, which tonifies kidney yang, nourishes original qi and warms the gate of vitality, expelling cold, strengthening the lower back and benefiting essence. Next we move to press on GB30, left. GB30 removes obstructions from the channel, it tonifies blood. Press on GB30, right leg. Next we're going to stimulate bladder 40. Left leg, clears heat, relaxes the sinews. Next we're going to stimulate bladder 40. Right leg, cools blood, eliminates stasis of blood. Next we're going to gently push the back with our elbow, redding the back. Gentle pushing over the entire back. And then we're going to rock the back to finish our sequence.